News briefing. The Board of Supervisors meeting went on fairly long today and just got done, in fact, a little while ago. So we're going to start with a couple of good news stories. Earlier today, your Board of Supervisors met and unanimously approved the creation of the Business Safety Framework to allow businesses to plan for a safe reopening when the time comes. This framework was created with the initial input we received from a broad spectrum of regional stakeholders throughout San Diego County, from the chamber groups to labor groups and everything in between. I want to thank all of my colleagues for providing input they collected from businesses in their respective districts and help to inform this initial framework. The ultimate decision on reopening from the state will be coming shortly. The governor is going to allow for reopenings of some businesses with restrictions on Friday. We look forward to seeing guidelines from the state, and they will be providing those, I believe, on Thursday, and we will explain that process probably in tomorrow's or Thursday's news briefing. I also want to note this morning the Board of Supervisors heard an update on the pandemic from our public health officer and our executive team. It was a long presentation, and I'm not going to be able to cover it all, but I do want to highlight a couple of key points. Dr. Natasha Martin, who is an associate professor in the Division of Infectious Diseases and Global Public Health at UCSD, made a presentation on how we are flattening the curve. Her presentation showed that social distancing, you all know what that term means now, has substantially reduced the spread of the disease to the point that we have prevented somewhere between 6,000 and 18,000 deaths in San Diego County as of the end of April due to this intervention alone. This goes to reinforce what we've been saying all along, that all San Diegans should be practicing social distancing and wear facial coverings. It truly can save lives. That's not all that happened this morning, as today we saw the opening of 3 coronavirus testing sites in the regions through the help of our state government, including one in South County where there has been a need for more testing. A doctor's referral is not required for testing at the above sites, but appointments are required. Appointments can be made by calling 1-888-634-1123. That's 1-888-634-1123. Monday through Friday from 7 a.m. to 7 p.m. Again, that number is to call to set up an appointment, and they will tell you when to go down there. We've talked about ramping up our testing so as to allow us to get a better handle on this disease, and we're seeing that ramping up this very moment. As I said, there was a lot that was covered, and you can see the presentation on the archived board video for today's meeting that is on the county website at stcounty.ca.gov. And now, please welcome Supervisor Nathan Fletcher.
Thank you, Chairman Cox, and good afternoon. Just to reiterate the point that Supervisor Cox just mentioned, the presentation from the UCSD researcher outlined that if we had not taken the quick action we did at the time we did, the specific number that they cited of deaths that we would be at as a region was 12,790 as of today. When you adjust that for the deaths we have had, that would put us at 12,660 deaths that we have avoided in San Diego County because of the actions we've taken. To put that in further context, that is the population of the entire city of Solana Beach. And so it is hard as you are working through a global pandemic where you aren't seeing overwhelming in your healthcare system, you aren't seeing a shortage of ventilators, you aren't seeing those types of things, to have a disconnect between the actions we've taken and the success that they have yielded. But I think that we all have to remind ourselves daily that the situation that has played out in many countries around the world and in many cities here in America is one that San Diegans have avoided. Because we started early, because we took quick action, but also because we had widespread community support. We had a community that joined with us together in these efforts to stay at home, to physically distance, to wash your hands, to now begin to wear face coverings. And as we begin to move forward and continue to move forward into this month of adapting and opening and changing I want to quote the words of Mayor Darrell Steinberg, who today I think summed it up really well when he talked about opening. He said, the question is not if we will open, it's not when we open, it's how we reopen. That is what is going to determine our success. And so as we move forward, we want to be clear, thoughtful. We want to continue to have actions based on the data that we share daily with you. But to do otherwise and to move forward irresponsibly would be throwing away all of the tremendous sacrifice that's been made and all of the tremendous work that's been done. We know people are anxious. We know people are in economic distress. We know that there is a desire to get everything back up and running. But if we don't do it the right way, we could have a second wave that could put us back in a horrible position, and we're working tirelessly to try and avoid that. That's why there is a phased approach to opening up. That's why when we talk about turning the dial, it is gently, it is in small incremental steps, and it is with a constant eye on the data that we see in front of us. The governor announced some loosening on restrictions on specific businesses that we expect to go into effect Friday. As a county, we believe we are prepared to move forward with those. Those were some of the limitations being lifted around curbside retail, particularly things like sporting stores, toy stores, bookstores, things like that. We think that is appropriate. And the governor said there could be additional flexibility provided to counties to move a little further in stage 2. We do not yet have what those conditions need to be, nor do we have what those entities might be that would be able to be opened. We're told to expect them around Thursday. And so when we get those, we'll be in a better position to know if we as a county are going to qualify and meet and what they are. But we'll continue to wait for that. But we are moving forward with the assumption on Friday, consistent with the governor's guidance, that we can make an initial step into stage 2 on Friday. Yesterday, I mentioned there would be 3 mobile testing sites that were up and running today. This is a partnership with the state of California. The state is providing this as a resource. We think it has the capacity initially to do close to 800 tests per day. Yesterday, we predicted they could have some hiccups, some bumps in the road, some difficulty with their first day of operation. Those predictions, unfortunately, turned out to be true. They did have some logistical challenges, some staffing challenges in getting those up and running. We appreciate the speed at which they tried to provide this resource to San Diego, and we ask all San Diegans to continue to be patient as the kinks get worked out, both with the website and signing up, along with the execution of how those tests are operating. We do know that there were hundreds of tests successfully conducted at those 3 sites today, and we expect every single day to see continued progress in smoothing that out, in increasing the efficiency, and continuing to make it better. Also today at our board meeting, our board unanimously approved the county appropriation of $5 million of CARE Act money to provide health care or child care vouchers to our health care workers, first responders, employees of essential businesses. I think one area we have to spend considerable more time focusing on as a region is the availability of child care and educational opportunities as we begin to reopen our economy. There's a lot of groups working hard on this, and we look forward to continue to engage. But today's action, unanimous action by the Board of Supervisors, is a positive step forward in that area. Next, we will briefly update you. We'll pull up our T3 slide here to update you on our efforts around testing, tracing, and treatment. Here you can see that today we're reporting 2,306 tests reported. Again, we have a goal that we've set of 5,200, but this is not written in statute or in requirements. It is just an initial goal we have set for ourselves as a floor for what we would like to get to daily. Over 63,000 tests total. We have increased our tracing capacity. Yesterday to today, we're now at 160. The county has received well over 1,000 applications and is in the process of background and onboarding, so we expect that number to continue to grow. And again, the 450 goal is just an initial goal. It's just something to organize around getting to. The real number when we get to there will likely be much greater than that, but this is to get us moving in the direction of striving daily to increase our number of contact tracers. Total investigations performed to date is now over 5,000. We also have 189 individuals that are currently receiving treatment for their coronavirus positive test in an isolation room in a county public health motel room, brings our cumulative to 567. The state testing I mentioned, I want to put this slide back up again just for information. If you would like to go on and register to make an appointment for testing, you see the website there, lhi.care/COVID testing. There are the 3 locations that are there. And again, every day we expect this process to get smoother and the numbers yielded from these testing to continue to increase. You also can call the number that you see on the screen right there, 888-634-1123. Into today's reports, today we are reporting a total of 140 new positive tests. This is out of the total of 2,306. Again, it is more important to focus on the percentage of positive as we see our testing continue to trend in the right direction more consistently at those higher levels. That is a 6%, which is tracking down a little bit from yesterday, but right in line with what we've been seeing over the past week or so. Hospital census ICUs are down to 135. Total hospitalizations holding pretty much steady at about 354. These are COVID suspected and related, both in ICU in the orange and then non-ICU COVID patients in the blue. If we go to the next chart here, you will see total COVID-related cases in our hospital there at the bottom in the 354. Non-COVID-related patients above it in the teal color brings us to 3,500 total. And again, you can see the dotted line at the top, which is current hospital system capacity. And that concludes my section of the report. I'll now turn it over to Dr. Wooten for her Public Health Officer's report.
So thank you, Supervisor Fletcher, and good afternoon to everyone. The statistics for COVID-19 continues to increase, and this is driven in large by our increasing testing efforts. Regarding global, national, and state statistics, based on data from the Johns Hopkins dashboard at around mid-afternoon today, globally, there are now over 3.6 million positive cases, including almost 255,000 deaths. Nationwide, the United States is reporting over 1.2 million positive cases, including almost 71,000 deaths. Statewide, almost 58,000 positive cases have been reported, including 2,278 deaths. Today, the County of San Diego is reporting 4,160 cases, which is 140 more cases than reported yesterday, as well as 150 deaths, which includes 6 new deaths since yesterday. Of the 4,160 cases, the age range again remains the same, from 3 months to 100 years of age. We still have, of the total number of cases, 51% are 20 to 49 years of age. Also, 49% are female, 51% are male. And of the total, 864, 21% of the cases have been hospitalized, which includes 274 individuals that have been admitted to the ICU. And this number represents 7% of the total number of cases, as well as 32% of the number of cases hospitalized. Lastly, the 150 unfortunate deaths represent approximately 4% of the total number of cases. Of the 6 additional deaths reported today, these include the ages between 62 and 95 years, 3 females in their early 70s and mid-90s, and 3 males in their early 60s, mid-70s, and early 80s. The date of death included 1 on April 30th, 2 on May 2nd, and 3 on May 3rd. All of the deaths reported today had existing medical conditions. Also, of the 150 deaths, 44% were female, 56% were male. And regarding race and ethnicity, we have 93% of the 150 total number of deaths, which means we do not have race and ethnicity at this time for 11 of the 150 deaths. Of this total, 69 or 50% are white, 53 or 38% are Latino or Hispanic, 10 or 7% are Asian, 3% are African American, and we have 1 each or 1% for American Indians, Pacific Islanders, and multiple races. Again, our sincerest sympathies and condolences go out to the family and friends of the 6 individuals whose death we announced today. Now, as a reminder, all of this information and more can be found on our county's website, which is at the bottom of the slides that we've shown, and also on this placard here. So, of the, now I'd like to report to you outbreaks in our congregate and community settings. Today, we are reporting a cumulative total of 56 confirmed active outbreaks. And we are happy, however, to announce that these outbreaks do not include any new outbreaks reported yesterday nor the day before. Of these active outbreaks, 37 are in congregate facilities, which includes 941 cases and 74 deaths, and 19 active outbreaks in community setting locations, which include 166 cases and 5 deaths. The county continues to applaud the public for staying the course and adhering to the stay-at-home order. It is indeed evident that our collective efforts have helped to decrease not only the spread of COVID-19, but also decrease the overall number of deaths over the past 2 months. And that was demonstrated today during the Board of Supervisors presentation by Dr. Natasha Martin. So yesterday, the state announced plans to move from Stage 1, which we are currently in, to Stage 2 of the California roadmap to reopen. And based on available data, we feel we are ready. So thank you, San Diego. Now please welcome back to the podium Chairman Cox.
Okay, let's go directly to the questions. Again, if you're not identified by name and outlet when you introduce, please do so before you ask your question.
Matt Hoffman with KPBS, please state your question.
Thanks for your time. I understand that 3 new testing sites are being contracted out by the state and operating in our county now. Earlier, you guys talked about ramping up, and I know that there's the goal of having 52 tests a day, but also making testing widely available in general. How do these sites help you with these goals? And in your daily briefings with the state, is there talk of bringing more sites or maybe even the county opening up some that are drive-through instead of ones where you have to just walk in?
Well, that goal is actually 5,200 tests per day, but I'll let Nathan Fletcher and then Rob Sills answer that question.
Thank you, Matt. The testing strategy is multi-pronged. We have things that we're putting in place to try and increase the utilization of our internal testing capacity here through our public health lab, and we are aggressively moving forward in that. There's opportunities where we can go to skilled nursing facilities, mobile sites that can go to hotspots, other types of things we can do to make sure we're maximizing our capacity. The second area we're spending a considerable amount of energy is working with our health system partners to break down any barriers that they may be facing, whether it be PPE or swabs or other types of things, to understand where they may have challenges, where we can help address that so we can increase their capacity as well. The third bucket is our commercial labs, which continue to do what they can. And the state resource is kind of a new one that is layered on top of it. We think that it has the potential, initially we believe we could be doing 782 tests on the 3 sites that we have now. But there is the potential that once the kinks are worked out and we're able to show the need, that we could potentially increase that as well. 5,200 tests is just a regional goal. That's based on the Harvard study and some other things that have come out, around 152 tests per 100,000 residents. And we would like to get that and then continue to grow beyond that to get to a higher number. The testing is helpful in terms of the ability to rapidly identify anyone who's positive, contact trace their close contacts, see if those individuals may be positive, and then have isolation opportunities available to them if needed. And those really are a kind of foundational part of how we're going to exist as we move forward. And so we're pushing on all of those efforts to try and increase them all simultaneously and to feed into our contact tracing program and then our isolation program. So we're grateful for the state. We know it was a little bumpy today, getting going, getting up and running, but we think every day those processes will smooth themselves out and we'll continue to see increase. But we do believe we had hundreds of tests performed at those sites today.
Thank you, Supervisor Fletcher. Yes, the 3 sites from the state came on. We continue to have 2 drive-up testings as well as a mobile drive-up testing that we will be putting out in southeastern San Diego. this weekend, I believe on Saturday. I don't have the exact date yet. In addition, we are doing a lot of work with the Office of Business Intelligence to do a heat map of where the largest percentage of positives are in the county. And we're looking at 2 additional sites down in the South Bay, National City area, so that we can place more both drive-up testing and permanent sites for residents down there. In addition to what Supervisor Fletcher said, is sending teams directly to where the hot spots and outbreaks are. And this will cross over any type of socioeconomical region, area. No matter what the situation is, we'll go out and take care of those folks. Thank you.
Okay, let's go to the next question.
Brandon Lewis with CBS 8, please state your question. Brandon? Should we come back?
Let's go to the next one.
Okay, Jill Castellano with iNewsSource, please state your question. What's going on?
Let's try the next one.
Anthony Pura with 10 News, please state your question.
I think we have issues.
Okay, I tell you what, apparently we're having a mechanical problem on the call-in calls, so we'll go directly to the text calls. If the call-in people will just be patient, we'll try to find out whether we can still get those calls or whether you need to call back later. Go ahead.
Okay, I'll start my first question from Terry Figueroa from the UT. Stay-at-home orders, state and county is his question. All the talk we have heard is about businesses reopening. What is the plan to lift the stay-at-home order in terms of allowing people to go out and congregate in small groups? For example, the park is open for people to play catch with family members, but when can small groups of friends hang out? What is the plan there?
Okay, Supervisor Fletcher is going to respond.
The stay-at-home order still is a statewide order. It's been put in effect by the governor, and at such time that that posture changes, then it will change for individual counties, or at such time that the governor tells individual counties they can change on their own, then we could. But for the time being, the stay-at-home order remains in effect. We have seen loosening, as you mentioned, around beaches and parks and boating, but again, those are to be limited to household units. All of these are an effort designed to limit the spread, and so we think as the state deems appropriate to move out of that posture, or as the state gives counties the ability on their own to move out of that posture, then we'll consider at that point.
Supervisor Fletcher, I'm going to have you go ahead and answer this next one. It's related. Can you address the fact that non-essential retail has already been offering curbside pickup for more than a month, from large chains to small mom-and-pop retailers? Have they been operating wrongly? Most business owners believe they've been following guidelines by shutting down physical stores, but still offering pickup services. Many business owners feel the update doesn't change anything, as so many have already been offering curbside service.
Well, individuals from the beginning, the governor outlined what were essential and non-essential businesses in the listing that is still on their website. So if individuals are covered by that and they are essential in that outline, then they've been okay to operate. What we're doing as we move to stage 2 is the governor will be adding additional businesses to that listing. And those will be additional businesses that can be open. And so the guidance on what businesses can be open is still driven and guided by the governor's executive order on essential versus non-essential businesses, and we would have to refer you to the governor's executive order and to that list.
Thank you, Supervisor Fletcher.
This next question deals with testing in the Hispanic community, and Dr. Wooten's going to respond.
Yes, this question is from Andrea. According to the county's most recent numbers, Hispanic or Latino individuals make up 54.8% of the COVID-19 cases in San Diego County. The Hispanic population is in the county is approximately 35%. Has the county identified if there are any factors that could be contributing to this population having higher cases?
Thank you for the question. I really don't think much should be read into that. People have access and they go and get tested, and we have identified, based on testing, and we review the hotspots on a periodic basis. We utilize that to identify where we should place testing sites. But also, we look at where we should place testing sites based on the populations that we want to reach. And that includes, in our testing criteria, vulnerable populations, the elderly, which would be the long-term care facilities, but in our communities, we want to test our elderly that are mobile and active, as well as various racial groups, which includes Latino. And then we want to make sure that we test all of the vulnerable populations that have underlying medical conditions, and individuals in rural areas, as well as our Native American population. So we're trying to paint a broad brush across the entire county to focus on all of those groups that might be at risk for developing complications. And certainly Latinos have high they have a high probability of developing underlying medical conditions. They have high numbers of heart disease, of diabetes. So those are the appropriate populations, as well as African Americans. And again, we are extending our testing capabilities to reach other vulnerable populations.
And Dr. Wooten, another question. We've asked a lot about golf in recent days, but we've been getting questions about from our readers about tennis. So I'd like to ask, is tennis allowed under the current rules? And if not, can you please explain why and when that may change?
Well, not at this time, but we are reevaluating once we submit our plan to the state to advance. After we go into stage 2 on Friday, regions counties and cities will have the capability to open up further if we meet or submit a plan and would be approved by the state. So, and we anticipate that we will try to do that. So we'll explore, including tennis. Usually if 2 people just play, that seems reasonable, but at this point, they are not included, but we will explore including them in the next stage 2+.
Okay, and I have a contact tracing question from Claudia with Univision. Can you provide an update on contact tracing? How many contact tracers do we have here in San Diego County, and how many will be hired? How many do we need comfortably to move to the next phase of reopening?
Currently, we have 160 FTEs, which is a full-time equivalent of individuals that are doing case investigations as well as contact investigations. And then we are hiring an additional, at this point in time, that could change, but right now our plan is to hire an additional 450 staff to be focused on contact investigation, and we are also planning to bring on promotors to be extenders or support to our contact investigators.
As a follow-up to that, she would like to ask about the use of technology for contact tracing. Are there any apps that the county is planning to use to help with this effort?
We are exploring all of the options that are out there as it relates to apps. We certainly know that Google and Apple have the tools, so we are exploring those tools and will land on the best one that fits the needs for us here in San Diego County.
Okay, thank you, Dr. Wooten.
We apologize to those people that were doing phone-in calls. Apparently, we're having some sort of a problem with our system today. So if you do have a question and you would like to text it in before the end of the media availability, you could do that on 619-430-0314. And if those texts come in after the media briefing, we will get back to you with a texted answer. Next question.
This is from Alexandra with CNN. According to Governor Newsom's reopening plans, some of the businesses that are considered Further in Stage 2 are offices, restaurants, malls, and schools. To clarify, is San Diego County awaiting the governor's approval and could hear back as early as this Thursday to learn whether some of these specific restrictions could be loosened?
Supervisor Fletcher will respond.
So to reiterate, what the governor stated earlier this week was that effective Friday, some of those limited number of retails for curbside, we would be moving forward as the state and counties could move forward into the initial part. That is the initial part of Stage 2. We believe we are ready to move forward into that stage. He alluded to the fact that individual counties may be given the option of going a little further into Stage 2. He did not outline exactly what those business entities would be, nor did he outline exactly what conditions counties might need to meet in order to certify that they're ready to move forward. So we're awaiting the guidance on both what would be the parameters, what would be the criteria you would have to show that you've met, along with what would be those categories. We don't expect that we're going to get any of those details until Thursday, and so we will have to stand by to wait the announcement from the governor, and then we will evaluate what it is and where we are and see what we can do moving forward.
And please, Supervisor Fletcher, I have one from Danny Freeman with NBC7. Now that we are closer to having businesses reopen again, is it feasible to realistically open up parts of our economy without opening up schools at the same time? Shouldn't the two be connected?
Well, that's a great question. That's one that I know a lot of folks are working really hard on. I think whether it is schools or camps or more child care facilities, I don't think it is feasible that you can significantly open up large portions of your economy if you don't simultaneously have the availability of child care. I don't know how parents would be expected to go back to work when schools are closed and there's not the availability of child care. And so I know just today my office has talked to the superintendent of public instruction along with folks who are working on issues around child care to really figure out what we can do to accelerate in a planning process or planning stage what those options would be, because it is vital that if jobs are going to become open, there has to be child care options, whether that be schools, child care, camps, other types of things. It is going to be essential that those opportunities are there in order to facilitate parents being able to go back to work. And so I do believe the two have to happen in some trajectory of similarity. It doesn't mean it has to be a full reopening of schools, but I believe that the problem of child care and child care options has to be addressed as a foundational part of beginning to get our economy moving again.
Oh, and I have another one. I'm getting a lot of questions, so bear with me, texting in as we're speaking. It's from Anthony with ABC 10 News. Many businesses have come up with plans to reopen. Is there a process in which they have to submit these plans to the county or state before they can reopen? More broadly, can you outline the steps a business needs to take in order to reopen?
So the businesses that can reopen, again, will be guided by the governor's actions and stages in terms of what we happen. What we passed today at the Board of Supervisors was a general safety parameter and framework, and I would refer you to that board meeting for things that businesses are going to need to do. They're not going to submit a plan for approval to the county, but they will have to develop a plan. They will have to post that plan. They will have to share that plan with their employees. And these are things around what they're going to do to incorporate telework when feasible, things they will do around physical distancing where feasible, things that they will do around temperature checks for employees, again, where feasible. And it's trying to provide a broad parameter so businesses know the types of things that they need to keep in mind as they develop their own safety and hygiene plans, and then they will post those. It's very similar to how 7 sectors of essential businesses are doing it now. When you go to a grocery store, you see the plan posted outside, and they make that, and so it'll be a similar structure and format.
Supervisor Fletcher, I'm going to get a couple more, and I think we're going to have to go offline to answer the rest of these, but a lot of questions about reopening. Will libraries reopen in Phase 2? Also, how about swimming and dental offices?
Well, dental offices were included in the governor's essential listing from the beginning, and so that they could move at their prerogative now. The other types of things, as Dr. Wooten alluded to, are additional dials that we will see how we can turn. Some of them are dictated by the state. Some of them are within our own local control. Some of them are impacted by mass gatherings. And so all of the array of things that are out there, things that are being considered and worked through as we come up with a systematic and gradual way that we can reopen.
Thank you, Supervisor Fletcher.
We apologize for the glitch on the phone-in calls. We're going to cut off the texted questions for now, but if you do text in a question, we will endeavor to get back to you with a texted answer by the end of the day. With that, it completes our media briefing for today. We appreciate everybody's attendance, and again, apologize for the lateness of starting. We'll be back here tomorrow at 2:30, and remember, stay in place, maintain space, and cover your face. Thank you very much.